Surge in coronavirus cases affecting both parts of the state line. I'm Laura Moritz.
And I'm Kelly Eckerman. Hospitalizations are up 27% in Missouri over the past 2 weeks. They're up 19% in Kansas.
We have team coverage of the Omicron variant spreading in our area.
Matt Fleener is following hospital capacity. Jackson Kurtz is focusing on testing demand. We begin, though, with Len Jennings, who's tracking an outbreak involving the Chiefs. Len?
Yeah, there are a lot of moving parts here, but the list is growing. But today, 7 more Chiefs players were added to the COVID list. They are Tyreek Hill, Nick Bolton, Rashad Fenton, Kyle Long, Lucas Niang, Armani Watts, and Blake Bell. It was just yesterday that Travis Kelce, Harrison Butker, and Charvarius Ward were put on that COVID list. Chris Jones, Willie Gay, and Josh Gordon missed last week's game due to COVID. If players are vaccinated, there's a chance they'd still be able to suit up on Sunday against the Steelers. Now, the NFL recently changed its COVID testing policy. There are no more weekly tests of vaccinated players and coaches. Instead, tests are performed at random. If vaccinated players or staff members report any symptoms, they're required to get tested. 47 NFL players tested positive on Monday. That's 10 more than the number of positive tests the previous Monday. Kelly?
All right, thank you, Len. President Joe Biden says the government will now provide 500 million rapid tests as the Omicron becomes the dominant strain in the country.
He's also increasing support for hospitals and redoubling vaccination and booster efforts.
Vaccinated people who get COVID may get ill, but they're protected from severe illness and death. That's why you should still remain vigilant.
Many people are trying to get tested before gathering with family members for Christmas. KMBC 9's Jackson Kurtz is joining us live from an Independence testing clinic. Jackson?
Well, Kelly, this testing clinic was announced this morning. We saw some people arrive just minutes before. It was supposed to start at 4 o'clock today. This is a free saliva-based testing site where folks will receive the results in 24 to 48 hours just before Christmas.
There is a certain feeling of deja vu.
Another holiday season and COVID cases are on the climb, with a similar need for more COVID testing.
Some people are doing it for travel reasons. Others are doing it just as a precaution before they meet up with family.
In Kansas City, health officials say almost 4,000 people tested for the virus in a 2-week period.
We really wish that people, would have heeded the warnings and the pleas earlier to get vaccinated.
To Independence, where its testing clinic on Tuesday only has about 200 PCR tests because of the high demand for testing.
Because there's more cases, because there's more exposures, it's incredibly important right now to get tested.
The city is also seeing an increase of the positivity rate at about 20%.
It's important to be able to protect your family, your loved ones. It's far better for you to know than not know and possibly put somebody at risk.
Health officials still stress the best way to prevent any new cases is getting vaccinated.
As much as we would love for the pandemic to be over, it's not. It's incredibly important to be vaccinated, protect your family and loved ones, and do everything you can for our community.
Now, tonight's clinic runs until 7 p.m. Independence health officials are working to have other opportunities to bring more clinics like this one to the city. In Independence, Jackson Kurtz, KMBC 9 News.
And the city tells us that testing clinic was made possible through a grant from the Mid-America Regional Council.
Hospitals are trying to keep up with the growing number of COVID patients. The University of Kansas Health System reported 16 more patients overnight. KMBC 9's investigative reporter Matt Fleener is live and getting more insight into what the next few weeks might look like. Matt.
Laura, in short, very busy. We spoke with one researcher and several medical experts here in the Kansas City Metro today about what the models are saying.
This winter's wave could be just as big as last winter's wave in terms of cases and hospitalizations.
Dr. Tammy Gurley with the University of Kansas Medical Center has provided valuable forecasts to the top leaders in Kansas the entire pandemic. She says, if you look at the black line on this chart of the latest numbers of cases in the Kansas City Metro, it's about as high as that orange line of where the model said we would be in early January.
We're kind of tracking that increase earlier than it was predicted.
61 of those active infections, only 2 of them are fully vaccinated.
Hospitals like the University of Kansas, St. Luke's, and several others around the metro are on the front lines of yet another wave, saying the vast majority of people needing beds right now have never received a vaccine.
And almost 100% of the most serious patients, those on ventilators, are unvaccinated. We're still able to take care of everybody, but it is causing more and more strain on an already strained healthcare system.
As for the next few weeks, hospitals are getting ready as the forecasts show what's to come.
We would definitely be predicting an increase in hospitalizations just based on an increase in cases.
Still maybe too early to say when that peak might be of this current wave. Another key problem is staffing. Staff has been going for the past couple of years here during this pandemic. They're burned out and they're hoping that you get vaccinated and boosted. Matt Fleener, KMBC 9 News.
And hospital staff members say they may have to cancel elective surgeries and doctor visits to make room for COVID patients. Right now at KMBC.com, you'll find resources on how to get vaccinated and get access to case numbers on both sides of the state line.